what is pediatric palliative care. A lot of people have misconceptions of what it is based on either previous experience or adult experience mostly. Pediatric palliative care is different from adult, but having said that, adult palliative care is now also changing and they are beginning to, I guess, work a little bit like us. But so what's unique about pediatric palliative care is that the care we give is to the child and their family. And that includes siblings, grandparents, and these are children that often have a life-limiting illness and all up until end of life. So it's not necessarily end of life or terminal care. Majority of our children are living, and we've had children on our books for many weeks, for some of them for many years as well. So it's about making sure that if they have any symptoms, that those are well managed, that we're providing emotional and psychosocial support, and making sure that they have access to respite and spiritual care, making and exploring what that means for each family. And also, we don't leave you when your child dies. We make sure that you're okay, that you survive intact, and we also offer bereavement care as well. I love this quote from this young boy, Marty, who says that palliative care no longer means helping children die well. It means helping children and their families live well. And then when the time is certain, helping them to die gently. And that's certainly what we try to achieve. Moving on to the components of pediatric palliative care. And what we do is we like to have referrals early because that helps us to establish rapport with the family, and also to establish what the family's understanding of palliative care is. So what we do is we do not take over. So we're an extra layer of support. We work alongside all the other treating teams and making sure that, I guess, your voice is heard, and also that we in the forefront is your child and also you as a family. If your child has pain or other difficult symptom managements, we'll make sure that you have a plan to manage those symptoms. We also discuss where you like to be cared for. Some families like to spend more time at home, understandably, and less time in hospital. And we as a team are privileged that unlike other teams in the hospital, we do home visits as well. And we work with teams in the community to help support you and your family at home. The other things that we consider, I guess, spiritual and religious issues and cultural issues which are important to you. And when appropriate, I guess we start discussing the hard things around resuscitation and life-sustaining measures and end-of-life care. Yeah, usually when we do that is we want to do that to prepare you. We do it when we think it's necessary, when things are changing, but that's not what we usually do at the onset. Usually this can be many weeks or months down the track, depending on where your child is in the disease trajectory, so that we make sure that you're well prepared. So I've kind of talked a little bit about this, and I guess when you work alongside other treating teams, we also work alongside curative goals. We've had children on organ transplant lists and who have gone on to have a heart transplant and are doing well, and we discharge them. So we do discharge patients from palliative care as well. And if your child is entering a clinical trial, that's fine. We support anything that we think will give you hope, or where there's a chance that your child can improve as well. And more importantly, we know that you as parents and carers need a lot of support, and we also want to make sure that your goals are heard, and especially when the child's condition is changing. So in terms, I guess, looking back at how pediatric palliative care differs from adults, pediatric palliative care, the numbers are smaller. Our children are often geographically dispersed. As a service, we look after children I guess the New South Wales state is divided into 3 child health networks, and we have 3 pediatric palliative care services. We have one at John Hunter Hospital, Sydney Children's Hospital, Westmead Children's Hospital, and the 3 services kind of divide the states. So we provide a statewide service. And we often have children. At the moment, I think our furthest child we are supporting is in Maji, and we also have children in Canberra. Most of our children have a non-cancer diagnosis, and they make up probably around 60%. And so it's not necessarily cancer like in adults. Most of our children, because of how interventions and medicine has evolved and improved and technology has improved, we find that a lot of our children are on our books for many years and sometimes to adulthood. And we, in that case, we would often transition them to our adult counterparts. We also, the other difference as well is that we need to consider children's development and psychological differences, and that impacts how we communicate and relate to children. And also in children as well, in pediatrics, we know that parents and carers are surrogate decision makers, and we take that into consideration in terms of decision making. And we know that children, unless they're competent to make decisions, they can't. And that can, when talking about procedures or I guess having like advanced care plans in children, we don't have advanced care directive unless they're able to provide that. And also we know that children with life-limiting illnesses are very complex. They are supported at home with technology, lots of technology. A child might be on a feeding pump, might need oxygen, might need a CPAP machine to breathe, and might be on lots of medications, which is different from adults.